Hi, this is Dr. Schwartz, and today we're going to talk about breast biopsies. What is a breast biopsy? A breast biopsy is where your breast surgeon or your radiologist gets a sample of your breast tissue to get a diagnosis. Perhaps you've had a mammogram or ultrasound where something was seen, and a radiologist recommended that you undergo tissue sampling to determine a diagnosis, and therefore you were recommended to undergo a biopsy, a breast biopsy. Now, the most common type of breast biopsy that's performed today is something called a core needle biopsy. That's where a small needle is placed into your breast to sample the lesion of interest to determine a diagnosis. This is most often performed with imaging guidance. That might mean that the radiologist or the breast surgeon might use an ultrasound or a mammogram to find the lesion, place the needle into the lesion, sample the tissue, and send that off for testing. Sometimes a core needle biopsy is not possible. Possibly the lesion is located far back on your chest wall, or the radiologist feels it's dangerous to stick a needle into your breast to determine the biopsy results, and he or she recommends a surgical biopsy. What is a surgical biopsy? A surgical biopsy is an operation where a breast surgeon typically removes the lesion of interest using some type of imaging guidance. The imaging guidance is typically a wire placed by the radiologist before surgery into the lesion of interest. That surgery is outpatient, means it typically takes about 20 minutes, you recover from anesthesia, and then you get to go home. When we perform the biopsy, we typically leave titanium clips in the area of interest to mark the surgical bed to make certain that we can go back if we need to. The results are typically back after surgery in 2 to 5 days when your breast surgeon will review them with you in the office. Surgical biopsies leave behind scars, although most breast surgeons, and certainly I, place scars in hidden locations, so over the long term, you really won't notice that scar. The recovery takes about 2 or 3 days, and you're back to work typically within less than a week. Thank you for watching. If you like this video, don't forget to subscribe and hit the notification button.